Stridor. It is a noisy respiration produced due to narrowed air passage. It may be due to inspiratory type, biphasic type, or expiratory. That is, if the noisy respiration is during inspiration, it is inspiratory type. If it involves pharynx and supraglottis, if it involves or it comes during the expiration, it is expiratory type. It may be due to involvement of thoracic trachea. If it is seen in both phases, it is biphasic type. It is due to the involvement of glottic, subglottic, cervical trachea. And the etiology behind this noisy respiration is coming from the nose. It may be due to choanal atresia, tongue, macroglossia. It is seen during cretinism, hemangioma or lymphangioma, lingual thyroid, micronathia, and Peary-Robin syndrome due to falling back of tongue. And then comes pharynx, tumors and retropharyngeal abscess. And then coming to the larynx, T for trauma due to foreign body injuries or edema, I for inflammatory like epiglottitis, laryngitis, laryngotracheobronchitis, N for neoplastic like hemangioma, papillomas and cancers, neurogenic like laryngeal paralysis and other congenital lesions like laryngomalacia, laryngeal cyst and all, and trachea and bronchi, TIN, same trauma, inflammatory and neoplastic plus congenital. And outside the respiratory tract, it may be due to retroesophageal abscess or tracheoesophageal fistula. Coming to the management, first we have to take the history and then physical examination. History, first we have to ask about the time of the onset to know whether it is congenital or acquired, and the mode of onset. If it is sudden, it may be due to foreign body or edema. If it is gradual, it may be due to laryngomalacia, hemangiomas, papillomas. And duration, if it is short, it indicates foreign body or edema or like infections. If it is long, it indicates laryngomalacia, hemangiomas, tongue and jaw anomalies. And history of trauma and aspiration of foreign body, and noisy respiration, whether it's related to feeding or not, as aspiration and laryngeal paralysis. Then coming to physical examination, we have to know the type, whether it is inspiratory, biphasic or expiratory. Then we have to see the respiratory distress. If it is seen, it indicates the site of the lesion, suprasternal notch or sternum or intercostal spaces or epigastrium. And then sounds, snoring, gurgling sound, heart's cry, expiratory wheeze. If it is snoring type of sound, it may be due to nasal or nasopharyngeal cause. If it is gurgling type, it may be due to pharynx involvement. If it is heart's cry type, it may be due to vocal cord or larynx. Whereas cry is normal in laryngomalacia and subglottic stenosis. Then expiratory wheeze, it may be due to bronchial obstruction. Then position. The stridor disappears when baby lies in prone position in laryngomalacia, micronathia, macroglossia and innominate artery compression. Laryngomalacia, micronathia, macroglossia, innominate artery compression. Fever. If fever is positive, it indicates infections like acute laryngitis, epiglottitis. and all. Then comes auscultation. We have to do auscultation with step on nose, open mouth, neck and chest for localizing the site. And we have to do examination with indirect laryngoscopy, and for children it may be with flexible fibriotic laryngoscopy under local anesthesia. Investigations by X-ray chest in both lateral view and posterior anterior view, and inspiratory phase and also in expiratory phase. And soft tissue, both posterior anterior view and lateral view to diagnose foreign bodies, and CT scan with contrast for any mediastinal mass or congenital vascular anomalies compressing trachea or bronchi. Example, anomalies innominate artery. Angiography for left pulmonary artery before doing operation. Esophagogram with contrast for tracheobronchial fistula and esophageal atresia. Then direct laryngoscopy to examine subglottic and bronchial secretions are collected for culture and sensitivity, and to remove any crust. It's done along with bronchoscopy. Then examination of larynx and esophagus is also done. Treatment is treat the cause. Thank you.